Second video here, I wanted to kind of run on the new Lifepak 15. On this one, we're going to cover the carbon monoxide component to this. One thing I forgot to put in the last video, just wanted to cover here real quick, was just how to change out these batteries. Now that this bag is here, it's really pretty simple. You just pull like the Velcro, pull the yellow tab down, and then you get to your batteries just like before. Keep in mind that this does now use the gray batteries. The white batteries will still be in the stock room for the suction machines, as well as the one Lifepak 12 that we're keeping. The QRV will still have a Lifepak 12. Okay, getting back to the carbon monoxide detection. As stated before, you're going to use this probe right here for carbon monoxide detection. Do be careful with that cord, like we talked about in the previous video, not to bend that up. The probe's just going to go on your finger like this. It does recommend that you do need the finger to be large enough to actually fill kind of the entire space there, and the finger does need to be pushed all the way against the back of that unit there. If somebody has long fingernails or something like that, hopefully there is a little bit of room for their fingernails to kind of go up inside there, and that should work. If not, you may need to actually try to use a different finger or something along those lines. It does want you to use one of these three fingers here. No thumb, no pinky finger. Pinky finger, they say, is going to be a little too small. You will get false readings if light is able to go around the finger. So on particularly small fingers, you may need to use the pediatric disposable version. Once again, please don't use this unless you have to. These are quite costly. This larger packaging is the carbon monoxide detection pulse ox probe, at dual pulse ox probe. These ones right here are just pulse ox probes. These will not do carbon monoxide detection. Okay, so keep those straight. Quick kind of rundown on carbon monoxide detection. Right here you can see it just says SpO2. You can force it to look at carbon monoxide by highlighting that field, and then under parameter you can go down here to carbon monoxide, and we can force it to take a look at my carbon monoxide readings. It will only do this for a short period of time, and then it'll default back to pulse ox. So you can see right now it was showing me at a level of 0, and then it defaulted back to pulse ox. So it doesn't stay on there. There's no way to force it to stay on that setting. So if you ever just want to take a look at it, once again, I'm still 0. Okay, normal readings. Let's talk about what the actual numbers are that you're looking for. A normal reading for anybody just on a normal day will be anywhere from 0 to 5. So anything 5 or under is really nothing to be concerned with. The machine does have an accuracy of plus or minus 3, so you can figure that whatever number you're getting, plus or minus 3 from that number will be the actual number that should correlate with if they had a blood draw or a blood gas was done. Up to 10% is not really considered, or under 10%, so 9% and below, is still considered to be a normal finding. They do say that most smokers will sit somewhere in that 5 to 9% range. So that could be normal for a smoker. Also may be normal for somebody that works around vehicles a lot, so maybe an auto mechanic or something like that, that's inhaling some gas fumes, or somebody that's been driving a tractor all day or something like that. They're probably going to sit in that 5 to 9%, and that's not really considered a problem. It's considered to be a problem at 10% or greater. That's where you're going to actually start kind of questioning whether there's an issue. Most patients, they say, will not actually feel any symptoms till they've hit about the 15% mark. So anything under 15%, they really shouldn't, they probably won't feel any symptoms. Anywhere from about 15 to 20%, they'll probably be experiencing symptoms. And then if they get up to around the 40%, that's really where you start looking at 40% and above is lethal. Okay, so those are really where you need to be ultra concerned, is when you get up into those much higher numbers. As far as symptoms that people will experience, apparently it's kind of anything and everything. Some of the stuff they teach you in school isn't really completely accurate. They say you'll almost never see really somebody that's got that cherry red complexion like they talk about in school. And if so, that's a really late finding. More normal findings that you're going to find would be your nausea, headache, chest pain. Actually, apparently a lot of the chest painers we run, don't be surprised when you go to put the pulse ox probe if all of a sudden you find out they actually have legitimately high carbon monoxide readings. They say that up to 80% of true carbon monoxide people will actually experience chest pain. So we might get called on a chest pain and you're looking down the normal cardiac route, and it turns out you're actually dealing with a carbon monoxide poisoning. So if you do get this alarm popping up on a chest painer, really look into it, okay? That actually could be your issue. Other symptoms, stumbling or difficulty with walking or gait or coordination issues, and then obviously later symptoms would be an unconsciousness as well. Okay, this thing does look at 8 different wavelengths. It looks at normal infrared or normal light, visible light, red light, infrared light. Basically, there's multiple LEDs trying to shoot through the finger. There are several different things that can cause a problem here with this sensor. So there's some problem-solving things. If you're getting some alarms, you don't think it seems to add up, you can do a few problem-solving things to try to determine whether you're getting a false reading, whether that number goes back down, or whether it's a legitimate reading. One of them would be lighting. Lighting is actually apparently one of the really big ones. If you're under any really bright sunlight, they said actually worse would be if you're underneath like the big halogens lights on a nighttime scene. Let's say one of the fire department rescue trucks had its scene lights up. That those will actually throw off their readings. So you do want to get these in a dark environment to try to determine a little better whether that's an issue. Nail polish can be an issue. Fake nails can be an issue. You may need to get that removed or try a different finger. Size of the actual finger, so if light is able to go around the finger. They did say we could probably get a false reading. Let's see if that actually works. I'm going to put my pinky in here just kind of off to the side and see if that gives us a false high value. The other one would actually be met hemoglobin within the system. So if you do get a false high reading, it may not be carbon monoxide, it may be met hemoglobin within that patient as well. So first kind of problem solving, is the finger properly placed? Is there light able to get around the sides? Is it a dark environment? As mentioned before, one of the tools that this monitor is going to come with is this little shroud. This is designed to be large enough to actually go over the entire probe, and then it's got a small Velcro wrap that'll actually seal it off, so that way it'll be a completely dark environment around that pulse ox probe. Let me see if we've been able to create a false high reading for me here with my pinky off to the side. Doesn't look like it's picking up anything. So my pinky off to the side, it's got no reading at all. Okay. Just for kind of understanding some of the carbon monoxide issues, carbon monoxide will actually last within a patient for 6 hours just on room air. So if somebody actually had true carbon monoxide in their system and then was moved out of that environment into good clean air and just breathing room air, take about 6 hours for their carbon monoxide to bounce back out to a normal value. If they're on high flow oxygen, cuts that time down to about an hour and a half. So you don't necessarily need to be thinking, that this person has to get to a bariatric chamber or anything like that. Really high flow oxygen should be appropriate to treat most of these patients in the short term. It's definitely the course of treatment we have available to us. Take about an hour and a half or so to clear that carbon monoxide out of their system. I think I've covered kind of just about everything about this. Once again, shoot me any questions if you have any on carbon monoxide detection. I'll do another video here as well.